Now I am going to apply the bag. Before that we should clean the skin part. So take a wipes, then clean around the stoma so that skin should be clean and dry. That time we should observe for stoma color also and the stoma output also. Sometimes patients may have watery stool discharge or constipation. Due to constipation, hard stool might be coming, so patient will have pain. So for that also we should observe the stoma. There should not be any discoloration of the skin or stoma. Take a flange, check for the size. If it is correct size, then apply the flange, secure it properly, then fix the bag as per their wish. Some people will like to keep their bag to the side of the patient, or they wanted to keep it straight, we can fix the bag straightly, then secure it with belt so that it will sit properly and patient will have confidence so that it will not leak.